Hello and welcome to our special COVID-19 update program here on Channels Television. I am Ladi Akeredoluale. Here are the highlights for tonight. Federal government clarifies Governors Forum proposal for nationwide lockdown, particularly on interstate travels. Minister of Foreign Affairs talks tough, warns that Nigeria will not tolerate Chinese racist actions against Nigerians and Africans. And World Health Organization says this is just the beginning as COVID-19 infections hit 2.6 million, leaving more than 185,000 people dead. The federal government says it is weighing the proposal by state governors to lock down the country, particularly in terms of interstate travels, to further contain the spread of the coronavirus COVID-19. The chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, said this amongst other updates during today's task force briefing in Abuja.
The request by the governors for a 2-week extension of the lockdown, but with specific emphasis on interstate travels. Basically, what they are suggesting is that travels from one state to the other should be stopped with certain exemptions of essential services, petroleum products, farm inputs, fertilizer, so that we can keep the wheel of our economy running. Like I said, that is their proposal. Federal government is here to take a decision in respect of that. And as to whether that will become part of our recommendation to Mr. President, the Presidential Task Force will meet and take a holistic look at all the proposals that are coming in as to the next line of action going forward.
Chairman of the Task Force on COVID-19, Boss Mustafa. Meanwhile, the Minister of Foreign Affairs, Geoffrey Onyema, has been blowing hot over the treatment meted out to Nigerians living in China. Mr. Onyema explains that the consulate has been briefed on protecting the interest of all Nigerians in that country and warned that Nigeria was drawing a red line.
We have been engaging with the Chinese government at various levels. At the level of our consulate in Guangzhou, which is where these cases of discrimination and racism have been taking place, and also at the federal level in China, in Beijing, with our ambassador and our embassy in Beijing. Now, we've made it clear to the Chinese government in no uncertain terms, unequivocally, that under no circumstance will we accept racial discrimination against Nigerians or indeed Africans or blacks in China. That is a red line for us. They have in turn told us that there is no case of that ongoing. But clearly, we are seeing videos. I have received reports, and we've told them it's unacceptable. And, we're also engaging with other African countries to decide and work together on definitive steps and measures that we will take because of this situation. In addition, I have directed our consulate in Guangzhou to systematically detail every single case of discrimination and every single case of loss or damage suffered by any Nigerian. And we will pursue it, each and every single one, very robustly with the Chinese government.
Foreign Affairs Minister Geoffrey Onyema. Let's stay in Abuja, and we're joined by our correspondent Kayla Megwa from our studios in Abuja. Good evening, Kayla. Trust that you're staying safe.
Evening, laddie. Yes, we're doing what we can here.
Now, the ECOWAS today met virtually online and talked about COVID-19. Can you update us with the details?
Yes, so it was an extraordinary ECOWAS summit, and it had all the heads of state and government from ECOWAS. And of course, President Muhammadu Buhari was in attendance of that meeting. Also had someone from the African Union, the AU commissioner, was actually there as well. Now, the discussions were around how the continent in itself can come up with a plan of action post-COVID-19. So some of the things that they deliberated on was the creation of a technical committee. They said they need a technical committee that would look at the impact of the disease on the African continent, especially the West African sub-region, and how the economies in West Africa can pick up after COVID-19. So that was discussed there as well. Countries took the opportunity to share with each other their experiences while trying to combat this disease and the challenges that they faced. And then many countries who probably are thinking, well, what do we do when this comes to us, or how do we handle the situation that we have right now? We're able to learn from the experiences of countries like Ghana and Liberia, and of course Nigeria as well. So that was discussed there at the meeting. The highlight of the meeting really was that President Muhammadu Buhari was appointed the COVID-19 champion for the West African sub-region. So basically he's going to be in charge of the West African response to this pandemic. So he graciously accepted that that particular appointment. And another thing that happened today was, it was interesting to hear from many of the African leaders there, especially the chairperson of the West African, of the ECOWAS heads of state and government, the president of Niger, actually stating categorically that he wants all the debts owed by African countries, whatever debt African countries are owing, he's asking that those debts be cancelled, not reduced, not postponed. No, he says he wants them to be cancelled. And it was interesting to hear the AU commissioner also re-echo those sentiments. So those are some of the highlights of the meeting today. But basically, coming up with a West African response to this pandemic, and how the economies in Africa and the people of West Africa will pick up post-COVID-19.
Is there any detail, can you give us any detail on this Thursday about compliance levels in Abuja or its suburbs, since we've been following that now for a couple of days? Is it better today, or is it same of the same?
It's the same, laddie. It's the same as yesterday. Now, you know, some people did send us some messages saying, oh, wait, there are a lot of emergency essential service providers in Abuja, which is very true. However, the issue has always been moving from one part of the nation's capital to the other, especially if you don't provide an essential service there. So what we're seeing is people who want to go to the market from Lugbe wanting to go to the market in Wuse, for instance, you know, so that would be an issue. And of course, community spread, this communication about the community spread of this disease. It was something that was talked about today at the ECOWAS summit as well. Community spread is one of the biggest fears. Now, if we're seeing more cases, and the truth is that most of the cases that we're seeing, laddie, is because more testing is being done. If more testing is done, we'll still see more cases. So people need to understand the danger of community spread. We do not have the facilities, and this was re-echoed at the summit today. We do not have the facilities on this continent, especially in this West African sub-region, to handle a catastrophe. If it goes into communities and we start to see the numbers that we're seeing in places like Italy or the United States, the medical ability of our health sector to handle that sort of emergency is very questionable. So that's something that people really need to understand. More communication, probably, laddie, maybe from the orientation agency. There is a lot of communication out there, but maybe more needs to be done to drive home the reason why people need to stay at home and obey the stay-at-home order.
Our correspondent, Kayla Megwa, thank you very much for that update, Kayla, and do continue to stay safe. From Kayla in Abuja, we go to Zaria in Kaduna State, where we're joined via Skype by a senior registrar Anesthesia and Critical Care, who is also the Secretary General of the Nigerian Association of Resident Doctors, Dr. Bilkis Mohammed. Good evening, Dr. Mohammed. Thank you for your time at this hour.
Good evening. Thank you for having me.
We're hearing a lot about medical personnel in this attempt to contain COVID-19 in this era. What can you tell us about the situation with Nigerian doctors and indeed medical personnel, given the fact that today the health minister admitted that more than 40 of them have tested positive to COVID-19?
Thank you very much. Indeed, Nigerian medical doctors have, before the COVID-19 era, been working in an environment that is unfavorable, essentially. When I say unfavorable, it therefore means that the basic equipment are either inadequate or are not available in some instances. And I want to tell you that this is worse off in state government-owned tertiary health institutions. Currently, what happened with the importation of COVID-19 into Nigeria is the fact that a system that is already weak in itself got overburdened by infectious disease that is deadly in itself. And considering the fact that the government has before now been extremely slow to respond of improving the health system, therefore means that as we speak currently, many of the federal and state government-owned tertiary health institutions are not equipped with personal protective equipment, beginning from face masks, the hand gloves, the N95 masks, the goggles, and the face shield that is important in the protocol of managing either suspected cases or cases that are already diagnosed. So therefore, we have state governments who are not responsive, essentially, in providing this equipment. A few federal government-owned institutions have made individual efforts to make provision for if some of these equipment in small forms, for instance, the National Hospital, the Ahmadu Bello University Teaching Hospital. But as I say, they are still grossly inadequate. And therefore, there is a need for federal government to intensify effort through the Presidential Task Force and the Federal Ministry of Health to make this personal equipment available for doctors. As we are aware that it's a disease that we are unfamiliar with is important in order to meet into the report the current transmission that we have observed.
We seem to be having a bit of difficulty with maintaining the contact with Dr. Bilkis Mohammed. Well, I'm told that she is back. So, Dr. Mohammed, we were talking about the situation with medical personnel nationwide, but allow me to ask you about other things now. The situation generally with the fight against COVID-19, how do you assess it, particularly in the northern part of the country? You're based in Zaria. The 16 northern or the 19 northern governors a couple of days ago said that they didn't have the funds to lock down the region, but now individually in various states, they are locking down in one form or the other. How has this seeming inconsistency affected the fight against COVID-19?
Thank you very much. It's clear that the testing capacity in the northern part of this country is still very low compared to what you have in the southern part. Just recently, Kaduna State and Kano State have a center for testing. And this further underscores the need for us to ensure that every state has a level 3 lab that has the capacity.
All right, we seem to have lost Dr. Bilkis Mohammed, Secretary General of the Nigerian Association of Resident Doctors. Now, if you're in Niger State, still staying in the northern part of Nigeria, but now in the north-central region, and thinking of going out to a public place without a face mask, you may want to think again. Our correspondent, April Simon, brings us an update from Mina.
The number of confirmed cases of COVID-19 in Niger State as at this time still stand at 2. But the government is not taking it lightly as it continues to take steps towards curbing the spread of the disease. Earlier in the day, Governor Abubakar Bello met with local government chairmen from the 25 local government councils and commissioners of various ministries, as well as heads of security agencies in the state. The governor, in the course of the meeting, directed the local government chairman to ensure that anyone coming from Kano State is quarantined for the next 14 days. This, according to him, is in view of the increasing cases of COVID-19 in Kano State. The governor also declared that the use of face masks by residents henceforth must be compulsory. He directed heads of security agencies to ensure that anyone found not wearing face masks from tonight should be arrested.
By this declaration today, public wearing of face masks and observation of social distancing are mandatory acts for all residents aimed at controlling the spread of the virus and other related diseases. My fellow Nigerians, young and old, please stay at home. And if for any reason you must go out, ensure you wear your face mask. The security agents have been mandated to arrest anyone found in public or outside his house without face mask.
After the meeting, the governor flagged off the distribution of face masks to residents in Mina. From Mina, Emperor Simon.
Let's move on to Bauchi State, where the state government has announced that a testing lab will be up and operational in the state in 2 weeks. Our correspondent Hajara Aliyu brings us up to speed with this and more from Bauchi City.
Thank you. In Bauchi State, individuals, groups and organizations are complementing government's efforts to cushion the effects of COVID-19 on the less privileged people. Behind me are food items meant for less privileged households, and this will be distributed by the Nigerian Air Force to 200 less privileged households in Bauchi State. This activity also coincides with the Air Force 56 years anniversary.
So for us as a Special Operations Command, we have chosen 2 communities. This community where we are now and Durum, to touch 200 families, not persons, 200 families. What you see us giving out today, we're able to cater for a father, a mother, and 4 children for the next 4 weeks. And the aim of this is to make sure that they have something to eat, because an hungry man is an angry man. And in the spirit of social responsibility, which the Air Force hold very dear, we have decided to do this morning in compliance with directives of Chief of the Air Staff. We also try to maintain the tenets of the federal government order. You can see we try to wash our hands, use sanitizers, and also maintain social distance. So while we are giving out this palliative, we're also very mindful of the directives of the federal government.
Yesterday, the state government held the Executive Council meeting, and the government resolved that the budget will be slashed by 50% in order to meet current economic realities. From Bauchi State, Hajara Aliyu, Channels Television.
We'll take a break on the program at this point. When we come back, we'll take a look at what is happening in other states. Plus, I'll be joined by a public health physician in the studio. Please stay on with us. Thanks for staying tuned. A woman who was assaulted by some police officers in Osun State for allegedly flouting the stay-at-home order is demanding for justice and wants the Inspector General of Police, Abubakar Adamu, to ensure that the perpetrators are made to face the wrath of the law. The victim, Mrs. Halima Abdulaziz, says she was assaulted by the officers on her way to get medical help for her ailing daughter at the Iwo axis of the state. She alleges that the officers, who were aided by other man-o'-war officers to inflict unlawful physical assault on her, failed to listen to explanations on her reason for coming out during the lockdown. Meanwhile, the State Police Command said an investigation has been launched into the allegation with a promise that the matter will not be swept under the carpet.
This release is important as a call on the Inspector General of Police to stand against the gross violation of the rights of Nigerian citizens, particularly those of women and girls, by unscrupulous officers who claim to be officers of the law and members of Nigerian police. I do not consider this as an attack on one woman. Rather, it is an attack on all Nigerian women. It is an attack on humanity. It is an attack on survivors of physical and sexual violence. It is an attack on women working to protect women. It is an attack on women's rights. It is an attack on harmless citizens. It is an attack on justice, and there must be consequences.
Mrs. Halima Abdul Aziz, who was allegedly assaulted in Osun State. Joining me in our studios is a public health physician, Dr. Tony Adeyemi. Good evening. Thank you for being with us.
Good evening. Thank you for having me.
It's not really cheery news for healthcare professionals. The Minister of Health today admitted that more than 40 of our health personnel have tested positive. Now, is this a failure to adhere to infection prevention control protocol, or is it that the virus is just that virulent?
Well, the virus is actually highly infectious. There's a difference between infectious and infectivity and virulence. Infectious is the ability for it to transmit from one person to another easily. Pathogenicity, the ability for it to cause disease, and virulence for it to cause death. So it's actually a very infectious virus, which we are aware of. Also, we have infection prevention and control protocols in place. However, this has not, because we do not have a national response system, there are some states that are not being carried along appropriately with some of these protocol measures. So the protocols exist. NCDC has developed infection prevention and control measures in which even the Nigerian Primary Healthcare Development Agency, they have some for their primary healthcare centers, which everybody is meant to follow. However, some of the things in the protocol, which include things like observing standard precautions, use of personal protective equipment, have been inhibited because we do not have enough personal protective equipment. Also, we have to there has to be rational use of these PPEs. So some of these things have not been well tailored down such that the private sector is involved, because there has to be a lot of private sector involvement. Some of these cases we're having are actually from the private sector. So there needs to be more engagement with this private sector to ensure that all protocols are duly adhered to and the provision to actually adhere to these protocols are actually put in place.
Now, we're talking about the harmony of response between federal and states. For example, in the case of the healthcare personnel that you mentioned, and the fact that some are better than others, so it's not uniform. In the same way, now it's been proposed that the country, particularly for interstate travel, be locked down for 2 weeks. Is this in line with what you think should be done now? Will this help with the cause
certainly.
of
Certainly,
containing this?
It would help because, for a fact, we know that Lagos is a bit ahead with the response management and the way they are actually responding to things right now. And because we didn't have a national lockdown, you might find out that some states actually have been able to contain the virus to a certain degree or a certain extent. However, if you now have travel, because this virus travels through humans. So if you now have a situation whereby you have a good containment measure in place and you're treating your cases well, what you have is an influx of more cases. Anytime anybody is suspected to have COVID, they try and find their way to Lagos, thinking that they might get better care at any of the isolation centers in Lagos State. So an interstate lockdown would actually go a long way in helping states actually contain the virus in their own locality and come up with local measures, because a measure that we might adopt in the south might be different from what they might adopt in the north, what would actually work or be effective there. So the interstate lockdown, I think it's a good one.
Is it cause for celebration that there are still some states that have no case of COVID-19?
No, it's not time to celebrate yet because there are so many levels to this pandemic. So states that do not have any cases, it may actually even mean that they are not testing yet because we know that there's a global shortage of even reagents. So these reagents are disbursed according to on a need-to basis. So it depends on states that actually need or have a lot of cases that have more reagents. So states that do not have cases right now, what they should be doing is adequate preparation. They should prepare for the epidemic as though it's coming tomorrow. So they should have isolation centers in place. They should have testing centers in place. They should begin to educate their community, engage community members such that they understand. Because community members might tend to feel that after all, we don't have a case, why are we locked down? Why are we at home? Not forgetting that the lockdown is not to stop the virus, but it's to give healthcare authorities adequate time to come up with a strategy such that by the time we're reversing this lockdown, even as we're having more cases, we're able to contain it. So states that do not have this should have an emergency operations center in place. They should start planning, meeting regularly, and come up with measures that can mitigate when when the virus actually comes to their states.
Community transmission now seems to be well established because the percentage of cases that are now imported has dropped drastically from what we had previously. Yes. Given the situation as we have it now, with what is going on, the second phase of the lockdown in Lagos, Ogun, and Abuja will end on Monday. If this governor's proposal for interstate travel sails through, that does not mean that there won't be movement within the states.
Yeah.
How difficult does this make the case surveillance that is already ongoing in places like Lagos, as well as the check with the communities to actively look for people and test them?
Initially, before COVID, we had like an active surveillance plan, which was already going on for polio. Polio is one of the diseases that we're trying to eradicate out of Nigeria, and we're in the final stage. So there's an active surveillance model which is in place, and we didn't have to lock down to continue the active surveillance case, although polio is not, the prevalence is not as much as for what we have now with coronavirus infection. So with a good active surveillance plan in place, empowering our disease surveillance notification officers, it will be easy, not that it will be totally easy, but it's still manageable to track down contacts of cases, even if the lockdown is reversed and everybody has to go back to work. Getting proper data, involving community members, because we need community informants to actually track down some of these cases. Unfortunately or fortunately, these cases, some of them are actually asymptomatic, so they do not present with any sign and symptom. That's why the community testing, decentralizing testing, and having sites where you can collect samples such that testing is easier or closer to the people is a good strategy, such that we are still testing. Whatever happens after the lockdown, after Monday, we don't know if we're going to continue the lockdown or if we're going back to work, but whatever happens, we're testing. There's modalities for testing. We have protocols in place. We have communities can come up and rally around and say we can have a quarantine bay or something, because the main issue, our major public health strategy right now is the social distancing. But because of the peculiarity of Lagos, Nigeria, overcrowding, it's a bit difficult for communities or a man in a 10 people living in his house and you tell him to go and self-isolate because he has had contact with a case. So communities can come around and say maybe a primary health care center, we can quarantine you there while you're waiting for your results or something. So we need to think outside the box and come up with local strategies to be able to solve this problem.
All right, then. Thank you very much, Dr. Tony Adeyemi. It's been a pleasure speaking with you.
Thank you for having me.
Thank you for joining us at this time.
Thank you.
Now, 25 states plus the Federal Capital Territory constitute the areas where COVID-19 cases have so far been recorded in Nigeria. From over 9,500 samples tested since the outbreak in the country, a total of 873 cases have been confirmed. 197 patients have been discharged, while 28 people have sadly been lost to the virus. A quick look at the demographics of the confirmed cases shows that the males account for 70% of the cases, while 30% of the cases were females. The website of the Nigeria Center for Disease Control, the NCDC, has more details on other aspects of the COVID-19 response activities and guidelines. If you go there, you'll have all the details of what to do if you suspect that you are either having a case of COVID-19 or you know someone who has that case, all the details of what to do and how to go about it are on the NCDC website. The chairman of the Diaspora Commission, Mrs. Abike Dabiri Erewa, says the Lebanese government has arrested one Mr. Wael Jero, who allegedly put up for sale a Nigerian lady by the name Busari Peace. Calling it a heartwarming piece of news, she thanked the Lebanese government for swinging into action immediately the incident occurred. Mr. Jero had marketed Miss Peace along with a Nigerian passport on a Facebook webpage, putting a price ticket of $1,000 on the 30-year-old Ibadan, Oyo State indigene. The Lebanese government announced that the culprit would be prosecuted for alleged criminal sale of a young Nigerian girl. And Mrs. Dabiri Erewa says the Nigerian government is interested in the case and will see it through. Also, the commission has disclosed that the federal government has secured the release of 60 of 73 Nigerians serving various jail terms in Tanzanian prisons. It explained that the Nigerian mission in Tanzania had been working on the repatriation of Nigerian prisoners in that country before the COVID-19 pandemic. South Africa's President Cyril Ramaphosa has announced that from the 1st of May, there will be a gradual removal of lockdown restrictions based on a risk-adjusted strategy. Although many of the restrictions will still be in place, according to him, the coronavirus critical levels will be stepped down from 5 to 4 to make room for gradual opening of the economy. Borders will, however, remain closed and movement across provinces will still not be allowed. While he acknowledged that the lockdown has achieved the objective of slowing down the spread of the virus, Mr. Ramaphosa says it cannot be sustained indefinitely because people have to eat. He also says the lockdown has given the nation time to strengthen the health sector capacity since it came into force on the 27th of March. The relevant ministers are expected to brief the media on details of the easing up of the lockdown. South Africa has recorded more than 300 confirmed cases overnight, with the number currently standing at 3,953. The death toll stands at 75, while recoveries are at 1,473.
Our people need to eat. They need to earn a living. Companies need to be able to produce and to trade. They need to generate revenue and keep their employees in employment. We have accordingly decided that beyond Thursday, the 30th of April, we should begin a gradual and phased recovery of economic activity. We will implement what we call a risk-adjusted strategy through which we take a deliberate and cautious approach to the easing of current lockdown restrictions. We've decided on this approach because there is still much that is unknown about the rate and the manner of the spread of the virus within our own population. The action we take now must therefore be measured and incremental.
South Africa's President Cyril Ramaphosa. The United Kingdom has begun the first human trial of a coronavirus vaccine in Oxford, the first in Europe. 2 volunteers were injected, the first of more than 800 people recruited for the study. Half will receive the COVID-19 vaccine and half a vaccine which protects against meningitis but not coronavirus. This comes as the coordinator of the UK coronavirus testing program, Professor John Newton, says the number of mobile drive-through regional test centers will increase from 31 to 48 to help test at speed where needed. Meanwhile, the number of infections around the world has risen above 2.6 million, and the global death toll is now beyond 185,000.
COVID-19 has infected more than 2.6 million people and killed at least 183,000 worldwide. But the World Health Organization says this is just the beginning of the pandemic.
Make no mistake, we have a long way to go. This virus will be with us for a long time.
Keen into this thought is German Chancellor Angela Merkel, who says this is just the beginning and the country risks squandering gains it has made in slowing the spread if it reopens too quickly. Her comments came as the death toll in the country passed the 5,000 mark.
Niemand hört es gerne.
Elsewhere in Europe, Spain has seen a slight rise in fatalities, 440 in the past 24 hours, bringing the national toll to over 22,000. Another 4,635 infections have been reported. The US has seen more than 46,000 deaths and 842,000 infections, the most in the world. In other developments, China has announced it will donate an additional $30 million to the World Health Organization to support the global fight against COVID-19. The donation comes days after the U.S. suspended funding to the WHO for allegedly mismanaging the COVID-19 outbreak.
Thank you very much.
And finally, with no new cases in 7 days, the Vietnamese authorities have announced they will start easing the lockdown in most of the country from today. There have been only 268 confirmed infections and no deaths.
We'll take another break, and when we come back, we'll take the view from way out in the United States. Please stay on with us. Thanks for staying tuned. Welcome back to the program. Our correspondent in Washington, D.C. in the United States, Maria Bird, joins us now. Good evening, Maria. Is the increase in COVID-19 testing the reason for the spike in reported cases in the United States?
Well, it's always been believed that many more people than were reported had COVID-19, just weren't asymptomatic. And so now that many people are beginning to get tested, that is believed to have somewhat of an impact on the increase of cases. But again, there's still a major shortage in testing that is available in the states across the United States of America. And so there's still believed to be many more cases out there.
What is causing the increase in the severe COVID-19 cases in younger people?
Well, again, younger people have been that population that has not really been paid much attention to. But again, many younger people, those between the age of 20 and 50, are on the front lines. And so they are the individuals that are oftentimes out there, and they are close to 40% of the cases that are in hospitals today. And so the spike is increasing among younger people. The spread is increasing among younger people. And what you're seeing is that many younger people are being hit with sudden strokes because the large arteries are being impacted by the virus. And so we're seeing that they are having some very severe incidents of major strokes.
Economically, how is the federal government financially supporting states and small business to address the challenges as a result of this COVID-19?
Well, that's a great question. I mean, we can see there's a very contentious debate between Democrats and Republicans. You have some Democrats that are saying that states should file for bankruptcy. And Democrats are saying that, listen, no, that should not be the case. We should be providing additional financial assistance. We just had 4.4 million people last week apply for unemployment. The small business loan program ran out of money. And so there's a second stimulus package that's being presented this evening that will be hopefully passed by the House this evening that will allow for additional small business loans. And obviously, you know, that would also help for hospitals, for testing, providing testing for many states so that they can purchase additional tests for their states. And so we're getting closer and closer to 50,000 individuals. We're over 47,000 deaths. We're getting closer and closer to 1 million. We're closer to 900,000 than we are 800,000 actual cases in the United States. So the situation is continuing to grow, even though in some of the hot pocket areas, you are seeing some decline in the death rates and you are seeing some flattening. So this is still going to be a long road for the United States.
Are we still seeing protests from those who are demanding that the economy be reopened at the various state levels and that life should go back to some sort of normal? Is that still ongoing? And if so, what is the reaction from official authorities, if there have been any?
Yes, many are asking. I mean, you have many people obviously that are going out and they're saying, listen, I can't feed my family, I can't pay my rent. And so they are looking for ways for the government to reopen small businesses specifically. But you have many other small businesses that are saying, listen, there was a woman yesterday that just said she had COVID-19 3 times and she's a small business owner. There's no way that her health could be compromised and she could potentially impact the health of her clients. And so many are still out there wanting, but there are others that are saying, listen, our health is more important. The federal government, the mayor of Las Vegas has come out and said she wants Las Vegas open again. You know, Las Vegas, the majority of the individuals that live in Las Vegas are part of the hospitality industry. And so that economy is suffering greatly.
Is there any concerted effort to put together the public and private sector in any way to reach some kind of consensus across lines for the economy to recover, to put politics aside, and for the economy to recover? Can you tell us anything about that?
Well, there have obviously been, the White House has brought in the airline industry. They've brought in technology industries. I mean, you can see Facebook is working with Google and the federal government to try to find ways to have technology being used for testing and to kind of do some pre-testing people can do at home. And so there's some efforts being made, but a real effort to see how do we get out of this. I think that has not, those talks have not happened. And we're still just at a point where you can see where people are trying to take care of what they can, and the corporations are trying their best to be partners with the government, but to have a full-out plan where they come together, I still think we have some more work to do in that area.
President Trump announced a temporary stop to immigration in its entirety as part of measures to deal with this. Have there been any reactions to that? And if so, what have those been?
Well, yes, he's put a stop to green cards, but again, people could still come here on temporary visas, and they're expecting that he will actually come out with some stricter immigration restrictions, potentially as an executive order. But many people obviously are very upset about the green card issue. They're very upset that he's potentially blocking the borders. He's stating that this is because he wants to, when the economy does get back up and running, have more available jobs for those who are here in the U.S., whether or not they're here on work visas in the U.S. or whether or not they are native U.S. citizens. And so that is what he's stating. But of course, Congress and many organizations are saying that that is not going to be best for the United States. And I think once things start to flatten out, we will really get to see some real pushback on lessening those restrictions.
Maria Bird, our correspondent in Washington, D.C., thank you so much for that update, and do stay safe out there.
Thank you.
From Washington, D.C. in the United States, now we go to Dubai in the United Arab Emirates, where we're joined by Maiwa Adegoke on the telephone. Maiwa is a Dubai resident. Good evening, Maiwa. We learned that the government has just released some guidelines for the reopening of some businesses in Dubai. What can you tell us about that?
Good evening. Yes, that's very true. Starting tomorrow, the government plans to begin what it calls the phase 1 of reopening and pretty much a return to normalcy in the city. So first, the 24-hour restriction on lockdown will be relaxed, and citizens will be able to move without permits around town from 6 a.m. up until 10 p.m. Malls will also be allowed to reopen from 12 p.m. to 10 p.m. at night. This also coincides with the Ramadan fasting season as well, and their guidelines as well, telling people how to go about their normal activities while they go out in this season. The number of guidelines have been put out, and this is what they're calling the phase 1 of getting back to normalcy in the city.
The metro is likely to resume operations during Ramadan, right?
Yes, the metro will resume on the 26th of April from 7 a.m. to 11 p.m. So yes, the metro will resume operations on the 26th of April, which is Sunday, I believe.
Thank you so much, Maiwa, for joining us at this time. Maiwa Adegoke is a resident of Dubai in the United Arab Emirates. Thank you very much, and do stay safe out there.
Thank you.
That's our package tonight on our COVID-19 special. Thank you so much for being with us. As we always do when we leave you, we ask that you check the NCDC, the Nigeria Center for Disease Control website, for the latest updates in terms of number of confirmed cases, number of active cases, number of recoveries, and of course, fatalities. The state-by-state distribution is also there on that website, as well as information snippets on what to do in whatever situation you find yourself concerning COVID-19. My name is Ladi Akere Doluale. Do have yourselves a wonderful evening. Good night.